Very grey and very difficult.
So I mean, could I send an email to our patients who've allowed us saying we've got this new treatment in? Or would that be considered more promoting?
Which is why I'm saying...
So if I want people to come in and do these threads, it's just hard for me. How do the patients even know I have them? You know what I mean? This is the difference. Obviously I can tell the ones I see.
You could have your estheticians just post it on
so the
on their Instagram.
So they could post that we have a new treatment for doing these threads.
Yeah, because that's their own social media. They
right, so that wouldn't affect us.
It should be okay.
God, it's so complicated.
Yeah, it's very complicated. Because if you go and ask the lawyers, they're gonna tell you don't do anything.
Of course.
Yeah.
But everyone is doing stuff.
Yeah.
You know, so it's like.
Okay, so this is what I'll do. I'll just clean the whole face with chlorhexidine. Okay, you could use betadine as well. Okay, and then I would use a few sterile tetraderms. Just all along the areas where my hands can potentially touch. Okay, so my hands can rest on there, and this area is all prepped. Okay, along with this. Okay, so this is all sterile. Okay, initially, if you're not too familiar with the procedure, you could do a little bit more. You could place a few more tetraderms and just make sure the whole area is clean. Okay. Now, in terms of the procedure, very simple.
Do you need that light, or are you okay?
No, I'm okay.
Right.
I'm okay. Very simple.
Yeah.
So 2 entry points and then 2 exit points. Okay. We would open the entry points with an 18 gauge needle. Okay.
Does that come with?
It doesn't.
No, we have to buy it.
Yeah. Okay. The needle from the thread is only 23 gauge, but because the cones are a little bit bigger, you would need an 18 gauge hole. Okay. So very simple. All you do is all you do is break through the skin. Make sure you've gone through the dermis. So the 18 gauge needle is usually you just have to make sure the beryl has gone through.
Yeah.
And that will be more than enough.
Yeah.
Okay. 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 So for the thread itself, okay. Now there's a 3/0 thread, very thin. Okay. And then you can see the cones and the knots. Now you're gonna have to tighten the knots a little bit. Okay.
Yeah.
So don't hold the needle, hold the thread. Okay, and just tighten the knots a tiny bit. Okay. It's a very delicate product. Okay, so just go slowly.
Can't pull too hard.
Can't pull too hard. Okay. So just make sure.
Can you actually snap it?
You can snap it.
Okay.
Yeah. So very gentle. Okay.
And you'll hear this kind of noise.
Yeah, you will. Okay. When the knots tighten, you'll hear these noises. Okay. And then you can see the cones. They can slide in between the knots.
So then you know if they can do that. Okay.
Okay.
So if you haven't done it right, they won't be able to move.
No, they will still move. But
how will we know we've done it right?
If you haven't done it right, you can still see the holes between the knots.
I think I had to keep my glasses on.
Sure. But you see on the next thread. I'll show again. We've got 4 threads. We've got 4 threads. So okay. Now in terms of insertion, okay, you have to make sure you've gone exactly the same way that you have punched in your 18 gauge needle. Okay. So the easiest way for that is that you could just slide this needle across the face and let the needle drop inside the hole. Okay. It does take a little bit of practice initially. Okay. You need to slide it and it will drop. Don't try and poke it through because this is a needle as well. If you try and poke it through, you're gonna create a double puncture, a double barrel. Okay. And then you can get a skin dimple. Okay. Which will still resolve, but it's just not great. Okay. So just make sure it drops inside. So very easy. You see a marker there. Okay. This is a 5mm marker. In an Asian skin, you would probably want to go 7mm because our dermis is a little bit thicker. Okay. So just make sure it drops in. The marker disappears. Now you're in the right plane already. Okay. So you can just turn towards your exit point. Okay. Now see if I'm got with it. Okay. Now you can see it is in the right plane because it's very easy to maneuver. Okay. So in this plane is very easy to move through. It's relatively planeless. Okay.
Do you ever meet any resistance?
If you meet a lot of resistance, then
wrong
it
plane.
is in the wrong plane. Okay, or unless the patient has done lots of things before.
Yeah, because
so
sometimes they do. end
They
up
might
with a
have
bit of
had done some,
fibrosis,
yeah, a tiny bit, but with the needle you shouldn't have any problem. Okay, so all you have to do is then just slide the cones through. Okay.
So you just go to near the next one.
Yeah. Okay, I'm gonna talk through each bit again. Okay, so again, you just slide the needle through. Okay, make sure it drops inside. It's a little bit more difficult on the second one, right? Because there's already a thread inside. Okay. Just make sure you're in the right plane. Okay, again, just checking. Okay, very, very good plane. That's not painful, no bleeding. Okay, and then you just go straight through. Okay. And then on the exit point, the reason why I use a needle cap to try and cap it out is because you don't want to angulate the needle superficially to the skin. You want the needle to come out along the same plane. Okay,
Right.
so with the needle cap you can push down the skin and just make sure it comes out underneath. So now all the cones would be embedded on the same plane. Okay. Now when you're pulling the cones through, okay, it's all about pulling and traction. A bit of traction here, tiny bit of pulling here. Again, it's a very delicate product, so if you get some resistance, just go through it slowly. It goes through every time. Okay, so just slowly pull all the cones through. Okay, and, this is it.
And what if you pull too hard?
Yeah,
you
just
can't
be
pull
aware
it all
that
out.
just don't touch
Oh
it.
yeah. I mean, if you pull too hard.
You can theoretically pull these cones.
Yeah, that's what I mean.
But it's very hard because
be
the
hard.
cones is
Because of the
opposite
shape, yeah,
directions.
yeah.
Okay.
So you'd have to pull it.
Yeah. Okay, so again, remember you can
Yeah.
see the knots. They're
Oh, yeah,
untied
yeah, I
right
can
now.
see them, yeah.
Okay, so you slowly tighten them.
Oh
Okay.
yeah, I can see. Yeah, it's a bit better with glasses on.
So you just remember you have to do this every time.
Okay,
Okay, you have to tighten it. Okay. The reason why this is so expensive is that all the cones and knots are handmade. So it's like a Ferrari engine. So it's all handmade, which is
Right.
why the pricing is so high.
I didn't know
Okay.
Ferrari engines were.
Yeah, they are.
Ah.
Which is why you never have to.
Interesting fact.
Okay. Again, same thing. Just slide through the needle. Okay. Sometimes it doesn't work the first time. Then you have to change your angle a little bit. Okay, just to make sure it drops in. Okay.
Easy.
Don't poke through. Now,
Right.
this doesn't drop in. Then I pull it back out, and I slide again. Okay. Just to make sure the whole thing drops. There's no downward movement. Okay. Once you're in, just angulate towards the exit point. Okay. Sometimes you might hear where the needle goes through the dermis. Okay, and then very easy, just guide your needle through.
If you were in the wrong plane, would it
If you're in the
be
wrong,
anything you could see superficially that would help
yeah,
you?
I could show
Just,
you.
just.
I could show you on the interior part. I'll just pull this through. Again, pulling and traction. Okay. Just a bit of traction. It will all go through. Now, the way I usually do is that I would have. This is how I do all other threads, even the Korean threads. Is I would have two fingers, okay,
Yeah.
and my two fingers will always be feeling where the needle is,
Right.
okay, the tip of the needle, okay. So by that, and I'll have my thread pass through my two fingers, okay, okay, and then I'll move my finger along. So all the time, I would know the depth of the tip of the needle, and I would know how long it's gone, okay. So always check your plane and make sure it's going through the right direction. Okay. If you go too superficial, okay, you would see some skin tear.
Yeah, you can
Okay.
see it.
If you go too deep, it will be painful and there will be some resistance. Okay. So, but the reason I'm doing it with the two fingers is that your other hand is going to adjust straight away. Because if you can feel that it's going too superficial, you would automatically aim a little bit deeper. Okay. So it's just a coordination process that you need to get used to. Okay.
Right.
So you make sure that you're always in the right plane.
The thing is, most of the patients here are Caucasians.
Yeah.
I feel like the bone structure is actually Like, they have much more delicate sort of bone structure?
The Caucasians would have, first of all, they would have a slightly thinner skin. Okay,
Right.
so you don't have to go as deep as Asians. Okay,
So that 5 mm should be,
it should be 5. In Asians, you aim for 7.
okay.
So
Yeah.
this mark is actually for Caucasians.
Okay.
Okay, because this is obviously a European product.
Mhm.
Okay, now you can see a tiny dimple there. Okay, that will resolve within 2 days or tomorrow. Okay,
Okay.
so there's nothing to worry about. As long as you don't actually double puncture the thing, then you won't have a big problem.
If you do double puncture and that dimple, how long would that usually take?
If you do double puncture, it will probably take about a week for it to
Okay.
resolve. It will still
that's not-
resolve.
So it's not
So
like
it's-
terrible. It's not
yeah,
bad.
yeah. Okay, so when you've done the procedure, okay, very simple. Okay, just cut the ends. of
Right
the-
at the bottom, and it disappears.
Yeah.
What if, does the patient ever feel anything sticking out? Not
If,
usually.
if you have
You've
gone
done it
too
properly.
superficial, or if the patient is too skinny, then they might be able to feel something initially,
Yeah.
but then it all resolves.
Impressive.
And would you normally, patients normally be able to just go back to work afterwards?